We are going to have a panel. We're going to do about 20-minute discussion with some of our previous presenters and a poster presenter. So it is Michelle and Rémi, Shari, and Amanda. If you could join us on the stage. And Liz and I are going to ask some questions. We'll also open it up. We want this to be a conversation that once everybody's situated, I'm going to start it off with a question. So I'm going to start with one question, and then we'll, I think, shift it up. So I know when we first sent out an email inviting you to the panel, we got back these kind of panicked responses like, I'm new to meta research. I don't know if I'm a meta researcher. Why am I being invited? Except Rémi, who has published meta research. So I'm curious, and maybe we'll start with you, Shari, sort of having attended today and heard these presentations and topics and themes, do you find the term meta research or considering the identity of meta researcher useful at all for things you've done or doing or trying to do? How do you think about that term today, right now?
Okay, perfect. Yeah, I would absolutely say that meta research is relevant for pretty much everything I've done in my career, even at the level of coordinator, without putting a formal label on it. So this really today has been very insightful in terms of some of the different things that we can do to be more strategic in research and to prevent kind of barriers to the research itself, not necessarily, the outcomes per se, but really the process of research. So absolutely relevant, I would say.
Yeah, I would say what I do is meta research, but I think in a semi-political sense, I would say still I'm a librarian first, and meta research is something I do that describes the kind of work I do to help other researchers along, or to understand like what sort of processes are happening when we conduct investigations or when we do science.
I was one who wrote back and was like, I don't think that you actually want me on the panel. Because I was like, I don't know if I do this. And then I was like, oh, I guess that I do. And I think it's like one of those things that like once you start to look for it, you recognize it's everywhere type of phenomenons. Because then I started reflecting on other work that I have done in the past or that I'm currently doing and realized sort of like how it fits into this meta research landscape. So I think it's like it needs like the marketing done so that we all are like, actually, I think that we are doing this.
Yeah, so that's a good point for the marketing, by the way. Very important. Good marketing. I think already a point of discussion is I heard about this field first as meta science and as meta scientists. Now we're talking about meta research and meta researchers, which is very interesting. You could think about, why one term or the other. I know when I write meta research in Google and Facebook comes up, the meta research that they're doing. So I understand the confusion here. There's some nuances to be had, but my lab right now, we study social identity and how that impacts everything from health to politics and to climate behavior and all sorts of different things. And I think by using these labels, meta research and meta researcher, we can actually claim this identity, and it makes us maybe more motivated to actually promote those ideas and those values of transparency and improvement of science and introspection. And so there's a lot to gain, in fact, from using these terms. We're labeling it, and then we can get people to think about it, get people to be curious. Oh, what is meta research? Oh, thank you for asking me the question. Now I can answer that. And maybe we have some publicity, or also the public can get thinking about those things. But if you don't name it, then it's very obscure and very difficult to discuss.
Thank you. So I want to shift to the audience. If anyone has either a follow-up from that or a question or how you think of the term meta research or something you want to put out there, and we will, back there, and then we'll repeat your questions so those online and everyone can hear. So if you want to introduce yourself.
I don't recall who was talking, but somebody was talking, and then maybe you like to be doing.
Right. And great question. I think it connects to several things that have come up in some of the talks and posters, sort of issues around AI, ChatGPT, and research integrity, the research process. Has anyone been thinking about that in your work or want to add anything to that question? Thanks for the question.
Yeah, I guess that I know that within health research, NYU Langone has been trying very hard to make sure that we aren't using any non-secure GPT, other AI tools that are outside of our firewalls to make sure that we're maintaining security. But that is definitely something that not all researchers at all institutions have access to. So we're very privileged to have a very forward-thinking and secure-minded institution working on those things. But those are questions that need to be tackled. And I think meta research is a good place to start thinking about those questions of how do we maintain that security for our participants when we're dealing more with these technologies.
Any other questions or thoughts that you kind of want to share with the conversation? Yeah.
One of the discussions, my chart was.
Yeah, I guess, sorry, just to repeat that. So the question was about the use of MyChart, which is a patient portal through Epic. And the question was directed towards Mahathi and her research.
Not only NYU, Langone, probably half of the hospitals in the country.
Yeah, no, Epic is everywhere.
Right, Epic is everywhere.
Yeah.
Said it better.
We might be able to I think it's a great question. We might be able to broaden it out in terms of meta research and the electronic health record. I don't know if anyone has any other intersections with that, or.
I guess that since I do digital health research as my non-meta research funding, that we do work with MyChart, particularly for recruitment strategies, like Mahathi's study was doing, as well as communicating like medical information, things like that, of like how to more successfully disseminate information to our patients. And so I think MyChart is definitely an opportunity to reach out. However, we have found a very low uptake of people actually engaging with MyChart. And so some of those will also be the question of how to get participants to engage with new technologies that maybe they're not familiar with or aren't part of their regular day-to-day workflow. And so I think some of those come down to a meta research question of how do you get people to uptake these new technologies, these new innovations that we're coming up with.
Thank you for that question. I think it's about interdisciplinary collaboration, but also about interdisciplinary methods, I think, too. And I just reflecting on your question, like there were several talks and posters that had teams that were quite interdisciplinary, right, in different skill sets, different professional roles. I don't know if you want to add something to that, Liz, or I think it's maybe a question also for the panel of like, in terms of interdisciplinarity in both how you work, but also research methods. Like, and Liz, if you want to start it, and then we can pass it.
I mean, I would love to hear from some of our panelists up here as well of that. I think that all of us end up working in a lot of collaborative relationships, but I guess in the sense of meta research and how we can support those collaborations, especially when they're interdisciplinary, what we can do to support, or maybe what additional information we need to get through our research to help make those choices.
I guess I think, and what I loved about our project is that we included like not just like there was Department of Population Health, but also the other departments. And I feel like I saw that echoed across a lot of the talks, that is not necessarily like an academic department. Like you're partnering with MCIT, you're partnering with IRB, you're having all these sort of more like the behind the scenes folks that are helping us to propel our like primary data or our primary research studies, but involving these types of partners in the meta research component, I think is what makes it like so rich and can really contribute to a project.
Maybe I can jump in as well. So I have a little bit of experience with multidisciplinary collaborations, and there are some significant challenges sometimes coming from different disciplines, different methodologies, different incentives. We don't agree on which journals to submit to, for example, and maybe we don't value the same things. We don't think about the problems in the same ways. But I understand that there's some research suggesting that multi-disciplinary teams lead to more creative kind of projects and research results that sometimes can have more impact because we have these different perspectives. So sometimes the cost of doing these collaborations can be worth. So for example, on the paper I mentioned before my talk, we collaborated with a philosopher who was the first author, and that broad perspective that sometimes we didn't have, and other cases with sociologists that look at the data in different ways. And the problem is that we are siloed, so we don't talk to each other. But for example, through collaborations like this, the Meta Research Symposium, we're able to indeed bridge this gap because we have something common. We all want to improve science and think about these problems in new ways to improve science. And so that's a great start. That's a wonderful start, in fact, to network, because that's the hub where perhaps in the future we're going to have more collaborations. We're going to know who's interested, who's motivated, and perhaps coordinate on some other kind of level of action, for example.
I have another example if we have
Please,
time.
Yeah, thank you.
So this is actually how I know Greg from a past life, a different role at Langone than my current one. But on the Recover Initiative, we worked directly with patients, caregivers, and community advocates throughout the publication process to translate the research into those scholarly dissemination pieces that go and then inform future clinicians. And so I think it's absolutely worthwhile. It's just one of those things that really takes a lot of logistics and manpower, womanpower to really bring it to life. And so absolutely factoring that in before you start a project and figuring out those opportunities for that is something that we would probably encourage across the board.
Yeah. Thank you. I just want to repeat the comment for those online that it's the importance of setting expectations around collaborations, interdisciplinary collaborations. So I think I want to put one concluding question to the panel, and these responses could be a word or a sentence, but if you could implement one change to improve how research is conducted, communicated, or evaluated, what would it be?
I'll kick it off just because we're talking about collaboration and that is my focus area, but I think really just like tearing down silos or at least bridging them, I think is one of the more important things. And, I'm an advocate of collaboration at any point. And I think that we can't move forward in science without collaborating with each other.
I mean, not to repeat a word from the prompt, but I think communication itself is key, not only explaining what we're doing to our colleagues, but really to reiterate some of the messages from this symposium, explaining what we're doing to our parents, to our family, to the world at large, and why this work is meaningful.
I would say support, and I think Langone does a really nice job of that through CTSI, through SEAC, through a lot of these different, and these are not Googleable terms, but go to the intranet. SEAC is the Center for Innovation of Advancement, Care. Thank you. And I just think there's so many resources, not a long-winded answer, but a lot of resources for research scientists, for people who might be lower on the totem pole, who are interested in doing this kind of work, that can bring in that different expertise or perspective as well. So utilizing support.
I'll go a little bit different and mention transparency. And I know we talk all the time about transparency to make things replicable, but I think one thing we're not necessarily transparent about as much is because it's not sexy for a journal to publish those really painful nitty gritty things that are happening when you're running a research study that are actually really important. And you sort of only learn colloquially through other researchers that then you can try to improve your process. But what if we were publishing all these all those really ugly, painful things that happen in research? We need a special journal just for that.
On my end, it's a tough question, Greg. I mean, there's so much to do, just so much, Maybe what we should do is take 5 minutes, sit down and write a manifesto together. And the next thing you know, you tell me, oh, it's a literature review now, and 2 years later, it's still not done. Right. But nonetheless, I think we can do a great deal in little time. Because there's already so many successful examples in the world and just people don't know about it, left and right. I'm going to give you a very specific example of what I think we should do. And that ties into the transparency kind of aspect, which I really, really strongly believe in, the open science movement and so on, and good research practices. And one of the benefits of working across disciplines, for example, psychology was kind of at the forefront of the replication crisis, and the open science practices, the open science framework, and so on. And so I thought we were like very cool and so on. But then I worked with the economists, and I saw that a lot of journals actually have a paid data analyst that reproduces the analyses from the scripts. And so when you submit your paper, you have to submit your data, you have to submit your scripts. And this full-time data analyst will make sure that this is reproducible and that you can actually back up your results. Because a lot of time in the research, some of the meta-research I've been doing, how replicable are the results in those major journals? We find errors, and we find a lot of things that actually, even with the script, we don't actually get the same thing. Those are the major errors. But with this simple tweak, having a paid data analyst for journals, we can find those errors, communicate with the authors, and then fix those errors, and then have much more replicable and reproducible science. And that's kind of a low-hanging fruit. I mean, why are we paying, so much money to these journals? I mean, the editor, you could be another reviewer, and a lot of people do it for free for many diamond open access journals or community-based or university-based. But then one of the real values of journals might be, okay, there's this paid person that's going to make sure your data is reproducible. And that's going to be a major step, I believe, for science. Every field should follow this. And I believe psychology should also do this as a first step. And then we can discuss all the other steps at the next symposium.
Yes, exactly. Well, thank you. I invite you all, first of all, applause for our panel. And then I invite you all to think about what that one change or initiative you would want to take on, right, to improve something in your research or in the research system. And then as you go to our reception, find a new collaborator to make that possible here at NYU Langone. And next year's symposium, you can present it. So thank you all. And thanks again to the CTSI for the generosity in making this event possible. And thank you to Liz for suggesting that we start a meta research collaborative and host a symposium. And here we are, and thank you for being part of it.